Hi, ladies. Welcome to Pathways to Fertility, a YouTube station dedicated to the women on the journey to conceive. I am Samantha Jacobs. I'm a licensed acupuncturist in Connecticut and New York, and I have dedicated my career since graduating in 2003 to helping women improve their fertility to conceive their dream baby. Today I am back for another video on RPL, Recurrent Pregnancy Loss. After creating the last video, I want to share a different perspective on RPL. That would be through the lens of Chinese medicine. I think what has frustrated me personally, professionally, I should say, is the perspective that miscarriages, FETs, frozen embryo transfers that fail, there's no implantation at all, they all get sort of put into a category of genetics. I appreciated the article, the research article I discussed, because they're a proponent for genetically testing miscarriage tissue, which would give a clearer understanding of what's actually going on. But that's not the current method nor procedure. So many of my patients are getting clumped into this. This is the genetics, this is the problem. And I feel like that's very limiting. And it doesn't explain everything. And I know my patients are frustrated with this dynamic. It doesn't even feel, it is really limiting that there doesn't seem to be another perspective in this avenue of infertility. Now, I'm going to be discussing the Chinese perspective because it gives a different view. If you're on the beach, you have one view. If you're at the top of the mountain, you have a different view. And I mean, at some point, when you get stuck in a loop, having a different perspective can be helpful. Approaching things from a different view can be helpful in getting a different outcome. And I would like to talk to you about how Chinese medicine sees the energetics of the uterine environment and how an embryo implants and carries to full term. I've been in the business long enough that recurrent pregnancy loss, I want to acknowledge, is highly triggering. And if you are a woman looking for information and you feel really tenderhearted, I know being put through a continual loss chips away at your emotional and mental well-being, and it can leave you very sensitive to lots of different topics and points of view. What I'm going to be talking about is looking at a woman's well-being and uterine environment to help her go to full term. And if you feel like that might be too much to listen to, this would be a video to skip. And I can put it in a nutshell that I've helped a lot of women get to a different place in all of this. And so Chinese medicine has something to offer you. And I just prefer for you not to listen to something that just adds like another rock in the knapsack. It's another physical burden that you have to carry. When we're looking at Chinese medicine to treat RPL, we want to keep in mind that Chinese medicine looks at the physical symptoms of a woman. And the view is by looking at what's not working well and bringing it into balance, increases her health, her vitality, the vision of herself, how full and nourished her soul and body can be. And we move the energetics to bring that all in place. I'd like to talk to you a little bit about the women I treat in my practice, because I just want to clarify who they are. In general, I get two broad categories. The first category, I get women who want to conceive naturally. They have experienced at least 3 miscarriages. They have ruled out IVF for a variety of reasons, and they are coming to me to try to problem solve around the frequent miscarriage. The second category of women I get have completed multiple rounds of IVF, have had their embryos genetically tested, and have banked eutroploidy embryos, so genetically healthy embryos. They go for FET, frozen embryo transfer, and depending on the woman, there's never any implantation, or they get a chemical pregnancy, or they have a miscarriage somewhere between week 6 and 8. And they are coming to me to try to figure out how to go in and do another frozen embryo transfer and figure out how to make it stick. So these are the two broad categories that I see in my practice. In the two groups of women, I think they are the 8% that are mentioned in the research article in the previous video. So there's 8% of RPL that is completely unexplained. And these are the women who are seeking my services. They often come to me and they are quite healthy. They are robust, they have full and abundant lives, and it doesn't make sense why they are having recurrent losses or that the embryos are just not implanting. We're looking at how a woman physically functions as a whole. Western medicine, their point of view is uterus and ovaries, genetic quality. In Chinese medicine, we're looking at all of you, from how your eyes work, your ears hear, how your sinuses function, all the way down to your toes. Do you have cold feet? We're looking at everything in between to be able to figure out what could potentially be going on that's not working well. Western medicine is just starting to explain and explore the complicated uterine environment. They're just starting to recognize that there is a communication that goes on between the embryo and the uterus. It's too much at the beginning phase to currently provide much in the offering of treatment. In Chinese medicine, we are looking at this complicated uterine environment, and we're looking at the communication of the embryo with the uterine environment. So in Chinese medicine, we start to see the layers of a woman's body's ability to provide this healthy environment and communicate with an embryo. In Chinese medicine, we see your body, we see the uterine environment as a diverse ecosystem. The best analogy for the uterine environment, this cohesive, layered system, the best analogy I could come up with is the hammock. So there are 3 components to a uterine environment that we would be looking at in a woman. Now, the first one is we actually have the physical uterine environment. I want you to think about a time that you went away on vacation and laid in a hammock, the perfect vacation. I in particular can think about that. went to some Caribbean island, and the temperature was perfect. It was warm, it wasn't too hot, it wasn't too cold, I wasn't roasting in the sun, right? And you are so comfortable in this environment that when you get into the hammock, you could stay there the rest of your life. That snuggling into this hammock, and there's a gentle sway, that you are at peace, you are at comfort as you snuggle into this environment. And that is a component of how Chinese medicine looks at the womb. It needs to provide an environment that calls to the embryo and allows it to feel so comfortable it doesn't want to go anywhere else. And in that environment, right, there is a calling to the embryo to stay. That the environment is just so comfortable, it couldn't imagine going anywhere else. Second, we have 2 firm trees or even poles that the hammock swings from. These 2 trees need to be upright, and they also need to have the capacity to sort of sway with the breeze. They need the capacity to allow the hammock to swing gently back and forth, right? So we have this perfect environment. We have 2 sturdy trees that can hold the hammock. And then we actually have the hammock itself, the third component. The hammock, it's the weave that makes the hammock isn't too tight, it isn't too loose. There's no holes in the hammock. Nothing worse than having your butt hanging out of a hole at the bottom of the hammock, right? You're able to get into the hammock. It has enough give that you can comfortably lay in it. So your butt's not dragging on the ground, and neither is it so tight that you can't get into it. I want to talk about 4 common scenarios that I see in my practice. Remember, energetics for a woman can present very differently from case to case, and these are just sort of generalizations. We have scenario number 1, where the trees, the poles, are weak and they kind of collapse on themselves. And you can imagine what happens. The hammock is like laying on the ground, right? It can't swing. And in fact, your butt's laying in the dirt. The environment may be warm and comfortable, but you're not supported. In the laxness of the trees, it also makes the hammock really lax. So you can see how they cross over into each other. And when we're looking at physical symptoms for a woman for this laxness, I see fatigue that, oh my gosh, I just have to like lay down. Or you're so tired, right? It's like your posture just goes away and you like slip into the couch, right? You can actually see the physical laxness happening in your body. You never feel rested. You're always tired. And it's like you can't, like your eyes, just like, oh my gosh, trying to keep them open is hard. You may have a chronic low-grade vaginal drip. There may be spotting, light pink spotting before periods. Your fertile cervical mucus may never get stretchy. It may only be watery. They would be signs that there are a certain amount of laxness going on in your energetics. In scenario number 2, we have a tight hammock. You can have a certain amount of tension in the hammock that when you get into it, the ropes cut into you. You feel like you're not being coddled by the hammock. that you're kind of laying on something flat. You don't feel supported. And in some scenarios, the hammock may be so tight you can't even get into the hammock. What are the physical symptoms? Lots of sighing. Sighing is potential indication the hammock might be too tight. Getting angry and popping a cork with PMS. Tight twisting menstrual cramps. Unable to sit down and relax. Can't unwind. Got to be busy all the time. Can't sit down. Got to be busy. Got to be busy, 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 busy. Pain with intercourse. Might be a potential in a tight hammock. Scenario number 3. Hammock in the burning sun. 2 sturdy poles, sturdy hammock, environment way too warm. Imagine like Las Vegas in the summertime, 115 degrees. There's absolutely no way you would want to lay in the sun in a hammock for an extended period of time. Physical symptoms: heavy menstrual bleeding that is bright, shiny red. Spotting before or after a period, which is bright, shiny red. Vaginal dryness or no fertile mucus. General dryness: dry mouth, dry throat, dry hair, dry nails, dry skin, dry eyes. And lots of sweating. Easy to sweat. These are symptoms the environment may be too warm. Scenario number 4. A hammock at the North Pole. Once again, trees are sturdy. Hammock is got enough tension. It's supportive. It's good. The environment is way too cold. You wouldn't want to lay there for too long. It's just not comfortable. What are the physical symptoms? Menstrual cramps that are better with like a hot pad, a hot water bottle, clots in the blood, pale, watery menstruation, no libido, cold hands, cold feet, cold belly, cold butt, clumpy, cloudy, fertile mucus. These would be potential signs the environment is too cold. So we can start to see from the list of symptoms that these are things that are not recognized in Western medicine, but they're recognized in Chinese medicine. And we would want to adjust the temperature, the hammock tension, the poles. We would want to bring all of that together so that the physical symptoms are coming together in such a way that you are now a robust, healthy, vibrant woman, that you are the best you can be. And that's the potential of working with Chinese medicine. So you can see from the list that we have an avenue to explore, to change, that there becomes a potential in improving the overall well-being of you, of that woman, so that she can be the best that she can be to go into another potential pregnancy. From my perspective, it's a place that Western medicine doesn't explore, which is repetitive loss leads to a weakening of the heart and the spirit. And when the heart and the spirit is worn down, the physical well-being also becomes worn down. And in Chinese medicine, we look to balance that. I in particular have a focus of that in my practice, that the experience a woman is having is not separate from the physical well-being, and that the two places need to be nurtured, addressed, taken care of, so that she can be the strongest woman possible. Well, ladies, that's my discussion on RPL from a Chinese medicine perspective. Please comment. If you like this video, please hit like, subscribe, be my second subscriber. If you have any suggestions for future videos, please post. And I appreciate you taking the time to listen. I wish you the best on this very hard and difficult journey. And I will see you for another video. Thank you.